G'day guys, welcome to another Pod TV and happy Wednesday. Today throwing my support out to the Wallabies this weekend in the World Cup quarterfinals against the English. I hope everyone gets behind their team this weekend, and remember this weekend, if you're not a rugby fan, great weekend to get on the World Cup because it's 4 amazing games. So that's my plug. I'm a big Union fan. Good luck to the Wallabies and everyone else who's playing. And today we're going to talk about treat the patient, not just their feet. So I think this is a really important thing that a lot of people miss. So let's just start with an opening phrase of we are health practitioners. Health practitioners. So we've got to think about that. So let that sink in. I'll quickly run through my admin and then we'll jump right in. So admin, next week's Simon Barthold will be joining us. It looks like that will be a pre-recorded, so I apologise, but we'll have Simon on talking about a topic of his choice. So if you have some things you want to hear from him, don't hesitate to post or reach out and we will ask those questions. So looking forward to having that, and then obviously we'll be launching Simon's athletic footwear masterclass off the back of that, and that's something really special to tune in for because we've got something pretty special to give you all that you'll need to be watching this to see. So if you are watching it and some of your friends are, make sure they're watching next week because we will be dropping that little snippet there. Apart from that, guys, jump on the dietary17.com page. We've got our 2020 calendar up, and we actually are looking to open up ticket sales soon for all those courses, plus a few others. We're looking to have a clinical biomechanical assessment course as well, and a clinical running course by the looks of things. So 2 extra ones on top of that, but we'll get back to you guys with that one. But there's a bunch of courses up there, and we're just going to do a little bit of a reshuffle and then we'll launch the tickets, guys. So looking forward to doing that. So let's go back to that opening statement. Treat the patient, not their feet. And then we are health practitioners. So as podiatrists, our scope of practice is the hip down. But as a health practitioner, we should be paying attention to the health of our patient. And that includes, and I'll talk the opposite, a patient having some mental health issues. If you think they're just stressed about something, they're worried about something. I'm not saying we have to treat them, but we should be then trying to help them or guide them to the best person, whether it's starting with their GP, whether maybe they should see someone to talk to, maybe sometimes just listening and then passing that information on to the GP if it's that important and vital is the most important thing. So let's start there. Firstly, one of the best things you can do treating your patient is, and to treat the patient, not their feet, is the language you use. So first of all, it's easy to say, don't swear in front of patients. It's unprofessional. Even if they do, I highly suggest you keep that professionality. That's just a tip. It's going to happen, guys and girls, sorry, but it's going to happen. But try not to. Don't make a habit of it. But that can also change the connotation. You might not realise a patient doesn't appreciate swearing. You might accidentally let something slip, and it might change the whole consult. Secondly, language like, I've done a pod TV on this before, but language like degeneration, negative words that can really, unfortunately, bring the demeanour of the patient down. So you might get a great outcome with their feet, but they walk away going, I've got degeneration in my feet and you can't do anything about it. It's not a great comment for someone to say and take away. So just remember that language you're using. And then thirdly, and I've done pod TV on this, is be excited about the treatment. So use exciting language, use good language, positive language. This is a positive thing. This is an easy thing to treat. People respond to these treatments really well. Phrases like that we can get a good outcome. Obviously, we can't guarantee, but don't tell them, I can't guarantee you anything. But you can say, look, we're going to work towards this and we're going to work through this, and this is something we can do together. So there's some really important things about the language you're using. Think about the language you do, and you can go through things where maybe you record yourself with the permission of the patient on an audio, and then go back and listen to that on the way home and see what type of language you use, because you might not even realise you're using it. Take the time to actually listen to the subjective stuff. So I know it's probably something a lot of us can skimp on, But take the time to actually listen and grab all the information from the patient, and make sure that you pick out the important parts, because what that will also do is it gives you a chance to see inside the patient's head what's important to them and what they hold important to them. So making sure that you actually connect with the patient can come from that subjective history. So that's really, really important. And they're going to tell you a heap of stuff that you probably don't really need to know about, but you've got to listen, okay? Because in between that and reading between the lines, you'll get, one, where their psyche's at, two, how they're feeling about today's situation, three, why they've come to you, why it's become such an issue, and four, probably how you'll have a good predictor of how they're going to respond to treatment in that one. Moving forward from that, get to know the patient a little bit. Ask about their family. Ask about what they do. Create some personability that this is a personal relationship to some. Well, that's not a good way to put it, but it's a personal relationship where they, Scott's my podiatrist, John's my podiatrist, Sarah's my podiatrist, Jenny's my podiatrist. They don't go, I go to ABC Podiatry. They actually go, I go and see this podiatrist. Because by getting to know and remembering that they have 4 children, they love football, and they work as an architect and they work for the government, things like that will make a big resonance to them, because it will definitely make them feel like you're listening to them, which you are, because you take that information on. And a bit of a good little tip for new grads is you can even jot them down in your notes. You can put little notes about special events coming up, daughter's wedding or something like that, so you remember to ask about it. It's a bit of a cheat. I know maybe it might rub some people the wrong way saying that out loud, but it is a good thing, and people do resonate with that. I probably wasn't 100% certain about it. I felt a bit, why do I have to do that when I started? A bit cheesy, but can make a big difference. So things like that. So get to know the patient a little bit more and learn about them, and create a relationship where they're actually coming to see you in the business rather than coming to the business and then seeing you. Moving forward, make an effort to address their main issue. So this is a really simple one, guys. Once they finish talking everything, you've collated information, the easiest question is, what is the number one issue you need me to help you with today? And they might have 4 issues that are foot or leg related. What is the number one issue that is causing you the most problems in your mind? My knee. And you're like, in the back of your head, you're like, geez, I thought the big toe was the big issue. They went on for that for like 5 minutes. My knee really hurts me and bothers me. Bang. You've just siphoned out all the mud and crap, and you've gone straight in for the kill. So please use that phrase. What is the number one thing I can help you with at the end of your subjective? And you can say, just to be clear, what is exactly that we need to do, so we can target that first. And you might not agree with them, and that's okay. Sometimes you might go, no, it's probably coming from here, so we'll target this area and we'll move forward, but this will affect that problematic area, the knee or something. So that's a big one. Address their issue. Don't hesitate to contact their doctor if you think it's really necessary. I mean, you don't want to overstep the line. There's this person who's sending letters and things like that, but like there's levels you can send as well. You can send a letter with maybe raising some concerns about, Jenny came in today and she was very depressed and she was talking very negatively about everything, and she wasn't enjoying the medication. She's saying it's making it sick. She might have said, I don't feel like the doctor's listening. Don't write that. You just repeat what she said and then send it to the doctor. So that's a way you can help the patient out with those things, by contacting the doctor in that way. If they've gone to a specialist and they're really not happy with the specialist, maybe you might feel there's enough there to write to the doctor, hey, maybe you sent Jenny to Dr. Smith. Jenny found Dr. Smith really quite rude and is not doing the treatments that are required because they're doing it along. Maybe you might need to talk to her or something like that. Obviously, you've really got to collect that information and make sure you're comfortable with it. But if you think it is creating a massive block in their healthcare and it's like something like a personality issue, it's super important to do something about that, I think. Obviously, talk to your mentor, talk to your boss maybe before you do it if you're not sure. But make sure someone cross-checks that letter to, all that information. Then if you really think there's a concern, you can call the doctor and you can leave messages. So, a letter can be a really subtle way, and then if you're like, oh my God, this patient's is on the edge and this isn't working or whatever, chump, get on the phone. This patient's no longer taking their diabetic medication. They don't care, they're over it, they're sick of it. You might just write, and the doctor may go, yep, I know, perfect. But you know that you did the best thing for the patient. So that's the other thing. So moving forward, next point, if you get some feedback from a patient that is negative and makes you feel frustrated and embarrassed and sorry to your boss and your staff because you maybe embarrassed the business a little bit, try not to get caught up in the frustration of it. Try and take a positive. When someone gives you feedback, anytime, anywhere, feedback's an opportunity for you to improve yourself and take that information as a positive nature. I think one of the strategies that I sometimes find is useful is I take feedback and I can sometimes think about it quite negatively, but I won't respond to things. I'll take a few minutes to think about it and collect my thoughts. I mean, if I've got more time, I've got 24 hours, I'll wait 24 hours. But take criticism positively. Don't get caught up in the negatives. Oh, it's that person's fault. It's not. No, it's on you at the moment. And what you can do is you can take the steps to improve that or fix that situation and take that criticism right there and then. Now, this might be to the extent where, the patient says, oh, I'm not happy with that and they don't want to come back to you, but they might still want to come to the business because they still love what the business did and you're still showing some of those colours. There just might have been a personality trait or something like that. So there's nothing to get upset about. It's something that you just got to go, okay, maybe was I too blunt? Was I telling them yes, no's rather than listening to them? Did I not feel like I was listening to them? Those types of things. And there's lots of ways to take that on board, but talking to your mentors and your bosses is a really good way to start with when you get that feedback, and hopefully that is filtered through those processes and they'll have mechanisms to help you out. But it's a positive. Criticism from a patient, I think, is always constructive. And you can make it constructive and find ways to make it constructive. So please don't get caught up in the negatives when you do get that. That's treating the patient, and part of that is communication and making sure that they're comfortable with that. All in all, gone through a few things there, but all these will help you get a better outcome with the patient. You build trust, they know that you listen, they know that there's a personal sort of connection through that. The fact that you listen to them and you understand that they have 3 kids and you know them by name, you ask how they are, and you're doing those personable things. You're going that extra mile to make sure that their whole health is taken care of and offering them referrals and services that can help them out. Beyond that, and you're asking what their major problem is and then targeting that. So you're being really clear and concise and you're creating really clear programs and treatment plans that they can understand. And maybe just to throw that in at the end of the consult, making sure you sit down and you go through it all and give them the handout, you write it down, and you ask them, do you understand what we're going to do? Are you happy to do that? And do you feel comfortable going forward with that? Those types of statements gets them to sign on, but it means you're treating the whole thing. They're signing on, they want to get better, and they know that you're going to take care of them, so you're building that trust mechanism. So let's all remember, we are health practitioners, health. We're here to help people's health, not just their feet in every circumstance. And keep those ears nice and perky and make sure you're collecting those small bits of information to make sure people are getting the best out of you. And then when someone does provide that feedback, take it on positively. And then if you feel you come slack or anything like that, take the time maybe to ask the patient if you can record an audio. So, it's very hard to identify patients through audio as such. And, obviously with your boss's permission as well, I didn't mention that, but make sure, do the right thing, but then go and listen to that on the way home in the car so you can get through that. So I'm going to leave it at that one, guys. So big messages next week, you need to tune in because Simon Barthold is jumping on. Thank you, Simon, for coming on board in regards to launching his athletic footwear masterclass in Brisbane next year in February 2020. Those tickets are on sale, but I highly suggest everyone waits until that video next week because we've got a bit of a bomb to drop. Exciting bomb. So tell your friends. I want heaps of people to jump on board. We will do a little bit more reminding for you, and I can't wait to see you all there, guys. Look at that, sub 15, go the Wallabies. I'll see you guys on the other side.